Hi everyone, my name is Bret. I'm a fourth year medical student here at the University of Arizona in Tucson, and I worked with a team of PGY3s, Dr. Carlo, Dr. Fernandez, and Dr. Trang, on a research pickup telehealth no-show rates in psychiatry during the COVID-19 pandemic. In 2020, research was done here at the U of A to assess no-shows in the adult outpatient psychiatry clinic. The rate at that time for no-shows was found to be 12%. Reasons for no-shows were also examined. Yet during the COVID-19 pandemic, care has fundamentally shifted, and psychiatry, like other specialties, has used telehealth to deliver patient care. Telehealth has removed a number of barriers, like transportation, yet no-shows still occur and have a significant impact. Research has shown that no-shows negatively affect patient care, worsen patient outcomes, reduce patient satisfaction, and increase emergency department usage. So in order to reduce no-show rates in the adult outpatient clinic here at the U of A, our research analyzes factors affecting no-shows to the clinic during the COVID-19 pandemic telehealth setting. The objectives of our research are twofold. Number one, to identify the no-show frequency in a telepsychiatry setting. And then secondly, to identify reasons for no-shows in a telepsychiatry setting. The methods of our research are as follows. First, we obtain information of no-show rates in the adult outpatient psychiatry clinic in 2021. Then we compiled a list of no-shows for all appointments, intakes, and follow-ups between March 1st and March 11th, 2021. Then over a 1-week period, we called identified no-show patients up to 3 times to determine their reason for missing their appointment. We compared and contrasted reasons for missing appointments in 2021 compared to that in 2020. And then we identified possible interventions to decrease the rate of no-shows going forward. As mentioned prior, our appointment data was based on appointments between March 1st and March 11th, 2021. And during this time frame, 107 encounters were identified as no-shows from a total of 1,048 scheduled visits, giving us a 10.2% no-show rate. And as well, surveys were collected for 62 of these 107 no-shows via phone calls. Demographic information of our respondents included that 3/4 were female, 1/4 was male. All respondents were between the ages of 20 and 79, with a third being between 20 and 29. And all scheduled appointments were with one of 3 groups of clinicians, residents, attendings, and psychologists. In the 1 year, the no-show rate in the adult outpatient psychiatry clinic dropped from 12% in 2020 to 10.2% in our study. Here you can see the reasons for no-shows. In blue is the data from 2021, and in red is the data from 2020. The most common barrier to telepsychiatry appointments in 2021 was forgot appointment at 21%. Meanwhile, illness was the most common cause in the in-person setting in 2020 at 29%. And as of note, no reminders, calls, texts, or emails were sent to patients for their scheduled appointments during the COVID-19 pandemic. Meanwhile, these reminders were sent in 2020. This lack of appointment reminders may have contributed to increases in the 3 leftmost categories here: not aware, confused time, and forgot appointment. Illness represented the biggest percentage change overall of any given reason in the 1-year span, with a decrease in 23.2% in the 1 year. Such a decrease and no-shows due to illness may be reflective of a number of things, namely a patient's ability to still attend appointments via telehealth when they're sick. This otherwise, of course, would have been prohibitive in the in-person setting. One barrier that was previously identified in 2020, transportation, decreased from 12.5% in 2020 to 0% in 2021. And in contrast with technology issues, which was a new barrier that arose within the telehealth setting and was reported by 3.2% of respondents in 2021. Our study limitations were twofold. Number one, that our patient survey response was 58% and decreased from 88% in 2020. Secondly, we had one patient with a disconnected phone line. As far as next steps, we recommend the clinic continue all reminders, calls, texts, and emails for appointments, and as well to consider continuing telehealth appointments going forward and allowing patients to choose their appointment setting. And here you can see our citations. Thank you all for your time.